As Malaysia proposed vaccine certificates for cross-border travel, the issue of diversity of vaccines used between countries come to mind. How can we allow vaccinated individuals from countries using a different set of vaccines into Malaysia or vice versa? Health policy specialist Dr. Khor Swee Keng weighs in.
900 million people, have received the vaccines, and the majority of them have received the vaccines from Pfizer, Moderna, or AstraZeneca. But this is not uniform across the world, because if you're in a low or middle income country, you're more likely to be using a portfolio of vaccines, including vaccines from China, and there are 5 approved vaccines from China. There is 1 approved vaccine from Russia, and in total, there are 14 vaccines that are in use around the world. So given high-income countries more likely to use 1 set, middle-income countries more likely to use a 2nd set of vaccines, and low-income countries vaccinating slowly and more likely to use a 3rd set of vaccines, we're seeing a vaccine disuniformity around the world.
What are the implications of this challenge?
Countries will now face 2 challenges when it comes to vaccine disuniformity, or a lack of, consistency in vaccine usage around the world. The first problem is, if I'm a country, in my country, I'm only approving vaccines A, B, and C, but citizens from another country are coming into Malaysia, but they have vaccines D, E, and F. From a regulatory standpoint, public health standpoint, epidemiological standpoint, scientific standpoint, and finally a foreign policy standpoint, is it okay for us to accept citizens from another country who have not been vaccinated with vaccines that have been approved and used in Malaysia? The safety profile and the effectiveness profile of vaccines A, B, and C are very familiar to Malaysian doctors, but we may not be familiar with vaccines D, E, and F. And if we're allowing people to come in who have been vaccinated with vaccines D, E, and F, that requires Malaysian doctors to be skilled or upgraded so that we understand vaccines D, E, and F as well. That is also leaving aside the question of, shall we say, double standards. Double standards in the sense of, if we're thinking that vaccines D, E, and F are good enough for other countries, why are we not approving them in our own country?